Hello. Sorry, there's a delay here. How are you? Welcome to the video this week. Every week I come to you live to talk about something in the healthcare space, nutrition, fitness, lifestyle changes, something like that. Today's topic is all about our medical system, what it's really good at, what it's not so good at, and how that might affect you. It's something that comes up a lot. I get questions asked a lot about this, and then certain groups that I'm in, I see questions asked about this a lot. The thing is, we want to believe that, hi Kende, we want to believe that we have insurance and that that's going to take care of whatever we need medically. But unfortunately, at the time of this recording, because I do expect this to change in the future, but at the time of this recording, in the United States here, our medical system is not set up to give us everything that we need at all. If we want to be living optimally, living as long as possible, if longevity is an issue for us, a concern, something that we're focused on, we can't just rely on the medical system that we have. And also, we can't just rely on our insurance to cover the things that we need for it to cover, which is sad and unfortunate, of course, because then that comes down to budgeting your own money, your own time, your own research into what it is actually that you need. But here's what I want to talk about today. The medical system was set up for 100 years ago, 200 years ago, when people were dying of infectious disease more than anything else. Hey Tiffany, thanks for watching. The medical system is great for that type of a model when people are coming in with infectious disease. Hello, good morning. And when, let's say for right now, when there's certain trauma, I'm very thankful that we have the medical system that we do, because if somebody's in a car accident and you want the best trauma surgeon around, we have things like that, right? We have ways to put people back together, knock on wood, thankfully, in many situations, right? That's what the medical system is really, really excellent at, okay? It's excellent at that emergency medicine. And what we then did was, when chronic disease started to creep up more and more and more because of processed food and more toxins in our environment, and even just the fact of living longer, because we were able to squash those infectious diseases, we started living longer and we started noticing more signs of aging and chronic disease, things that we hadn't dealt with in the past, right? Because of that, we just tried to, and not we, I wasn't around 100 years ago, we tried to take the medical system the way that it is and the way that it was great for the infectious disease and the emergency medicine, and we tried to just have that sort of swallow all of the other issues like the chronic disease, the diabetes, and PCOS, and those types of things, right? Autoimmunity, inflammation, those issues, and we tried to have that just sort of fall under the same umbrella of that medical system, and that's when we're finding it's failing, it's not working. Now, I'm somebody who's been on both sides of it, both as an employee and also as a patient on both sides of this issue. So for those of you that don't know me, I'm Tara, and I'm a registered nurse, spent lots of time working in hospitals, and then decided that I wanted to take a step back and help people in a more holistic way. And I very specifically decided not to become a registered dietitian. Now, I don't want to piss off registered dietitians. They are awesome, okay? And many of them have even gone back to more schooling to have more holistic education as well. But even if they haven't, they are amazing, again, inside this medical system. We need that. If a loved one is inside the hospital and they need tube feedings, PPN, TPN, something like that, tube feedings, they are the ones that have that information. They've gone to school for a long time to get that education, right? They are the best people for it. But once again, insurance companies want to believe that those are the same, that education is the same type of education then that we should be using when we're trying to prevent disease, or when we're trying to maybe put another disease process into remission. The very diseases that, if you ask the medical community, they will tell you it's impossible to put certain conditions in remission. Things like diabetes, type 2. It is still being taught out there, and I know because I was on the receiving end of this information, it is still being taught out there that type 2 diabetes is just a progressive disease. that multiple sclerosis is just a progressive disease, maybe remittent and progressive, but that it's eventually over time going to get worse. And there's a lack of education in the fact that, functional medicine, holistic medicine, lifestyle changes, nutrition, fitness upgrades, things like that actually have the ability to prevent certain diseases from getting worse, and also, dare I say, make those diseases get better, possibly even so much so that the symptoms and the blood work and all of that comes back normal for a while, as long as that person doesn't go back to living that same lifestyle. So what am I talking about? I have PCOS, and I word it that way, that I have PCOS, because it's something that I'll always have to keep my eye on. But currently at this time, I have reversed all of my blood work and signs of the PCOS to the point where I am no longer diagnosable as having it. Now, if you had asked my doctor years ago if that was possible, she would have said, no, it's just something that's going to get worse. And here are the things that you have to worry about down the line. And here are the things that are going to happen to you kind of no matter what, right? I don't believe in that. I believe our bodies have this innate ability to heal themselves when we get out of our own way. And that's really important. Insurance companies, unfortunately, have not gotten on board with this. There are a few exceptions. I mean, I know certain insurance companies will cover acupuncture for certain conditions, but not for other conditions or whatever. So it's a slow moving progress in the right direction. It's going in the right direction. But currently they do not cover any sort of holistically trained individuals in this arena. So here's what I want to tell you as a consumer, right? So someone who's living here, I'm assuming you're here in the United States. If you're watching from another country, I'm sorry, I don't know exactly how your system is set up, but what I want you to know is that the way our system is right now, it's like you are young and vibrant and healthy until you are aging and sick. And I can only help you when you're aging and sick. I meaning the medical community, right? And for the most part. I've actually heard doctors say, you have pre-diabetes. What should I do about it? Nothing, just come back to me when you have diabetes and we'll put you on medication. What? That is mind-blowing. That is mind-boggling, and that annoys me so much. Just wait for something to get worse and then put me on medication. I don't even understand that. Of course, there are always things that you can do. If you're seeing a practitioner and when you're asking, is there anything that I can do on my own to make some sort of upgrades, and if they say no, that's a red flag that that's not the practitioner for you. If you believe that you do have some control, right? I mean, maybe for you, that's what you want, but chances are if you're watching this video, that's not something that resonates with you. The whole idea here is that there's a big gap between being young and vibrant and healthy and no signs or symptoms of anything, and then being quote unquote sick. There's a big gap in between there. You might start to notice signs of aging. You might start to see signs of inflammation or autoimmunity or something like that. Stubborn weight loss, different signs that are telling you that your body and your health is not really up to par where you think that it should be. And that gap right now is currently a gap in our system. It's something that's not managed well in the medical model, and it's unfortunately something that's not really covered by insurance. So that means in that gap where a lot of us are right now, in our 30s and 40s and 50s, a lot of us, right? We have to pay for that. We have to do the work ourselves, do the research, pay for the help that we need in that area. It's something that we have to budget for. And I know for a lot of people, that's nearly impossible, right? If you're living paycheck to paycheck, it's very hard to justify paying hundreds of dollars for a holistically minded practitioner. But I just want you to know there are so many things that you can do on your own. There are so many things that you can do that don't cost any money or hardly any money in order for you to start feeling better. You're not stuck here in this middle ground, like you left the whole perfectly healthy, 18-year-old body and you're waiting for that real sickness to come. It's not that your hands are tied behind your back. There's so much that you can do here in this space. And I think a lot of people also then they think they have to go to these doctors and pay all these expensive bills when maybe it's not up to that point yet, right? And listen, I'm not telling you not to go to the doctor. It's really important that I get that across to you today. I go to doctors I take my kids to doctors. I'm not telling you to not go, but I'm just saying, just know what their specialty is. Know what they've been trained in and know where their area of expertise is. And please don't think that their area of expertise spills out into these other areas where it's actually our responsibility to take care of ourselves in that way, right? So anything that really comes down to your nutrition, you can make those changes on your own. And guess what? You can do it for like no money or really, really cheap, right? A lot of times we can find things that you are paying for. Let's just say you have a grocery budget and you want to eat healthier. There usually are things that you can cut back on to make room for the other things that you want to buy that are upgrades, or the few things that you want to buy that are organic or something like that. There's things that you can do. Exercise doesn't have to cost any money. You can walk, you can do squats in your house. You don't have to have a gym membership. You don't have to have a personal trainer, right? Those are things that you can do for free. You can move your body more for free. Even like the more advanced strategies for longevity that are like the hot and cold switches back and forth. I don't know if you know about this, but we have something called heat shock proteins in our body, which helps us to live healthier and longer. It basically builds up our resistance. And so when our body's exposed to some heat and then cold, you can do this by taking a cold bath or shower, going in a sauna. I mean, if you live anywhere near me on Long Island in New York today, you can just go outside for a while. It feels like a sauna outside. And those things help us to build up our health, build up our resiliency, and things like that. Those are free, right? Those are free things that you can do. So there's so much that we can do. I just wanted to come on here and discuss and maybe start the discussion here about the fact that there's so many people stuck in the middle that think that they don't have control, that think that if the doctor told them there's nothing for you to do, then there's nothing for them to do. It's not the case, okay? It's not the case that there's nothing that you can do in your power to improve your health, improve your energy, improve your body, and all of the things that you're looking to go for, okay? Let me know in the comments below if you have a specific issue you're dealing with. I'd be happy to help you. I also have a free Facebook group where I answer people's questions. I share anti-inflammatory recipes every week and workouts. And so if you are on a health quest, if you are in this middle ground here, like most women in their 30s through 50s, I would say, at the very least, let me know. I will let you come into the group as long as you're a nice person. That's really the only requirement. And come join the conversation. Come learn for free. Get the resources that you need, because you need to take control over your own health in these phases, right? Have your doctors, know when you're going to need them, but also know that you also have to be your best advocate, because nobody else is going to do that for you, okay? I hope this video was at least a little bit inspiring, that you have more power than you might think that you do. And the other thing that's great about this is that, like I said, our system's going in the right direction. It might be taking a long time, but eventually I do believe insurance companies are going to come around and cover more of these preventative type care. Maybe one day you'll even be able to come see me and have it covered by insurance. That would be fantastic. I'll see you guys in the next video. Bye.